Like me, you want to get back on the field as soon as possible after ACL surgery. But when will you be ready?
There are many factors that determine when you can return to your sport after surgery. Let's go through those now.
Okay, here it is, the big question. How long until I can get back to sports after my ACL injury? While we wish there was one answer that fit everyone, the reality is there isn't. But that doesn't mean there aren't general guidelines. In most cases, you can expect to return to pre-injury level 6 to 9 months after your surgery. However, there are several factors that can alter your timeline, including whether or not there were other procedures that were part of your ACL reconstruction, your ability to participate in physical therapy, and the type of activity you are trying to return to. When you're sidelined with an injury, waiting 6 months or more can sound like an eternity before you're back in the game. The key is to remember that over that time period, you're not actually waiting. You'll be working hard and staying active by doing your exercises with your physical therapist and at home. And while you may not be back to competition, you'll be performing sports-related activities all the way up until game time. When coming back from an ACL injury, your body is always going to respond best to a gradual, progressive rehab program. Think of it like rungs on a ladder. Each rung is a new step in your recovery, and you can't just skip from the bottom to the top. The bottom rungs are exercises that help bring back mobility and range of motion. Your knee is still healing at this point, so be gentle. As you keep climbing, you'll be building strength and balance, and eventually, you'll be reaching for goals like agility, velocity, plyometrics, and sport-specific activities. Anytime you suffer a traumatic injury, it can be like hitting the reset button. Physically, but also mentally, it can take time to get your confidence back. So stick with your team. They'll make sure you get through it and come out ready to play. The final rung in the ladder is to get the seal of approval from your doctors and physical therapists. They will use several tools to help gauge your readiness to return, so let's discuss how some of them work. The first major component is a battery of functional performance tests performed with your physical therapist. These are designed to measure the strength and function of your knee as it heals. Tests like the single leg hop and the single leg squat are used to compare the strength of your postoperative knee to your uninjured knee. Other tests may include active and resisted leg exercises or more dynamic drills, such as shuttle runs and side-to-side shuffling. These tests produce objective, quantifiable data and have long been used in determining whether you're ready or still have more work to do. Newer techniques include video analysis of the mechanics of your knee and can accurately determine whether you've regained the necessary strength and control to maintain proper technique. This data is also used to pinpoint possible deficiencies that you should be addressing in your physical therapy. Once you've passed your tests, you'll be cleared to return to sports in a gradual manner, starting with non-contact practice, then slowly advancing to contact drills, and before you know it, you'll be at the top of your ladder and back in action. So, just because your favorite pro athlete or teammate came back at a certain time, it doesn't mean that you will be the same, and that's okay. What's important is that you returned at the time that is right for you.
Thanks for stopping by. See you next time at ReadySetMed.